Hi, this is QD Clinic. QD Clinic is brought to you by RheumNow.Live 2023, March 18-19 in Dallas. We hope you'll be there. Great rheumatologists like us go to great meetings like this. Today's case is a double seropositive, but only a few joints. What do you call it? So a 49-year-old man comes to see me. He has a complaint of an injury in his wrist and hand pain. Goes to his doctor. Doctor does lab tests. Sed rate's normal. ANA's negative. Rheumatoid factor was a low positive at 25. Doesn't have much else to show for it at that point. Maybe his knees are swollen. It's really hard to tell. So we give him a intramuscular steroid and a 15-day course of prednisone, and he comes back in about 5 or 6 weeks. At that time, he says the steroids really didn't do him much, just made him jittery. He's still having mostly knee pain and some wrist pain. And really his history is only notable for diverticulitis a number of years ago and a history of alcohol abuse many years ago. He's currently only taking celecoxib 200 milligrams twice a day and having some gastritis. On exam, you find both knees to be clearly swollen with 2+ synovitis. He has mild synovitis in the right wrist and a limitation of motion because of pain and swelling. Now the question is this RA? It's not 4 or more joints, it's only 3. It is chronic. It is synovitis. Does he meet criteria for RA, and do you even need criteria for RA to give him treatment? My answer is he doesn't really need to meet criteria for me to treat him when you have swollen joints. That's chronic and not responding to simple measures like a nonsteroidal or a short course of steroids. But if you go with the ACR-EULAR criteria, he does barely meet criteria in that he has 2 or 3 large joints. That's 1 point. He has double positive CCP. I said he's double positive. His rheumatoid factor was barely positive, but his CCP was strongly positive at about 200. So he's double positive. He gets 3 points for that. Now he's up to 4 points. You need 6 for the diagnosis by these new criteria, using this new classification scheme. His sed rate was normal, but his CRP was high at 20 milligrams per liter. You get 1 point for that. So he goes from 1 point for large joints, 3 points for double positive, and 1 point for the CRP. That's 5 points. Oh, it's chronic, more than 6 weeks. He gets another point. Now he gets the 6. So he does barely make the criteria on a point basis, but I don't think you really need to have these points to treat it when you have a chronic synovitis, especially of 2 or more joints, and it's disabling and it doesn't respond to special measures. I would have treated him. Now, the interesting thing about this is his alcohol history and his diverticulitis history. Diverticulitis history, you wouldn't want to use a JAK inhibitor. Alcohol history, you're not rushing in to use methotrexate or leflunomide. And ideally, you could treat him with simple measures like hydroxychloroquine, but honestly, the response rate there is going to be low and slow. So we opted for a TNF inhibitor, and we'll see how that goes. Why a TNF inhibitor? Because I'm trying to get him off the nonsteroidals. I'm trying to get a better, quicker response because he's had this now going on for close to 4 or 5 months, and he can no longer work. So again, you can be seropositive. That doesn't guarantee the diagnosis. but you need a few joints to then commit to the diagnosis and treatment for rheumatoid arthritis. Tune in for more QD clinics. Bye.